Hello, my name is Vince. I'll be your nurse for today. Before we get started, let me just wash my hands for 20 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Can you please state your name and date of birth? Okay. Do you have any allergies? No? Okay. And are you experiencing any pain or discomfort today? No? Okay. Just double check with your wristband. Okay, the information matches. So today I'll just be inserting a urinary catheter as well as collecting a urine sample from you as your doctor has ordered. This is due to urinary incontinence, which is like trouble urinating. So that is the reason you're getting a catheter placed in today. So have you ever had this procedure done before? Yes? Okay. So I'll just review this procedure with you again one more time. If you have any questions or concerns along the way, please let me know. So I'll just be lifting up your gown here. I'll clean the perineal area. Once the area is clean, I will then insert a urinary catheter and collect a urine sample from you, okay? Okay, so generally this shouldn't be a painful procedure, but you may feel some discomfort. If you do experience some pain during this procedure, please let me know. So did you have any questions or concerns before we get started? No? Okay. So from my observation, the patient is in good physical condition and is not in any physical distress. Just gonna go ahead and hand hygiene. Some gloves. I'm gonna clean my work surface for 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, now that has been 30 seconds, I'm gonna dispose of my wipe, dispose of my gloves. And then I'll let the table dry for 2 minutes and then close the door and the curtain for the patient's privacy. Okay, now that it has been 2 minutes, I'm gonna wash my hands for 20 seconds. Put on a clean pair of gloves. I've got my supplies. My kit. My stat lock, my syringe. Okay, and I'm gonna go ahead and pull down the blanket and then lift up the patient's gown. Okay, I'm just gonna move your legs in a frog-leg position, okay? Okay, and I'm gonna go ahead and grab my wipes. One wipe down the middle or to the side. One wipe on the other side. One wipe down the middle. Okay. I'm gonna go ahead and dispose of my wipes. And I'm just gonna put your gown down partially while I prepare my kit. Okay, I'm gonna go ahead and remove my gloves. Hand hygiene. Put on my new pair of gloves. dispose of the packaging. Okay, I'm gonna go ahead and open it up. Okay, I'm just gonna reposition the kit. Then I'm gonna grab my syringe, drop it in, dispose, and grab my block, drop it in, dispose. Then I'll grab my CHG wipe, drop it in as well, dispose. Okay, now that all my materials are prepared, I'm gonna go ahead and lift up the gown again. Okay, and I'm gonna dispose of these gloves. And hygiene. And I'm gonna grab the sterile gloves. Okay, dispose of the record. I'll go ahead and grab the drape. Put it between the patient's legs. So I don't need this, so I'll go ahead and remove it. Go ahead and move my kit closer to me, actually. I'm gonna go ahead and move this to the sterile drape. Okay, I'm gonna spread the labia. One clean down the middle, or down the side. dispose. One clean down the other side, dispose. One clean down the middle, dispose. Okay, I'm gonna go ahead and insert the catheter. On the count of 3, just take a deep breath, okay? 1, 2, 3, take a deep breath. Take a deep breath. Okay, so I see some urine return. I'm gonna go ahead and advance the catheter in an extra 1 to 2 inches. Okay, I'm gonna go ahead and inflate the balloon now. Okay, I'm gonna gently tug to make sure that the catheter is in place. Okay, catheter is secure. So how do you feel after that procedure? Okay? No pain, right? No pain? Just a tiny bit of discomfort? Yes? Okay. So I'm just gonna collect a urine sample from you now. I'll go ahead and grab my CHG wipe. Clean it for 5 seconds. 1, 2, 3, 4, 5. Okay. Dispose of the wipe. Wait 5 seconds for it to dry. 1, 2, 3, 4, 5. I'm gonna go ahead and grab my syringe. I'm gonna draw out around 5 to 10 cc's of urine. And since this patient has urinary incontinence, there's current urine flow or constant urine flow. So I'll go ahead and grab 7 cc's of urine. Okay. So I'll grab my container. Put 7 cc's of urine. Dispose. Okay, now that I have my urine sample, I'm just gonna label the specimen cup with the patient's name, MRN, date, time of collection. And I'm also going to be putting the specimen cup in a biohazard plastic bag, and I'll send it off to the lab. Okay, just going to remove my sterile gloves. Hand hygiene. Put on another pair of gloves. I'm gonna grab my skin protectant wipe, wipe the outer leg. Go ahead and grab my stat lock. Go ahead and lock it in place. Remove the adhesive and stick it to the outer thigh. I'm gonna go ahead and hang this under the bladder on the bed. Okay. And I'll go ahead and clean up my materials. Okay, so we're all done with this procedure. Did you feel any pain during this procedure? No? Okay, that's good to hear. I'm just gonna go ahead and pull down your gown now. Lift up your blanket. Okay, so here's your call bell. If you have any questions or concerns, just hit that red button. I'm also gonna be putting your bed in the lowest position, putting the side rails up. Do you have any questions or concerns right now? No? Great. So I'll just go ahead and document the date and time of the procedure, patient tolerance of the procedure, size of the catheter, which is a 16 French, the color, amount, and description of the urine. I will also be handing off the urine sample to the lab. Anything else before I go? No? Okay. Just gonna remove my gloves, hand hygiene, and then I'll take this off. Hello, my name is Vince. I'll be your nurse today. Before we get started, let me just wash my hands for 20 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Can you please state your name and date of birth? Okay. Any allergies? No? Okay. And any pain today? No? Okay. Let me just double check with your wristband. Okay, the information matches. So your doctor has ordered to have your urinary catheter removed. So have you had this procedure done before? Yes? Okay. Well, just as a refresher, I'm just gonna go over it with you one more time. So I'll be removing the stat lock with an alcohol pad, and then I'm gonna remove the catheter. So this shouldn't be a painful procedure, but you may feel some discomfort. If you feel any pain during this procedure, please let me know, okay? Okay. Do you have any questions or concerns before we proceed? No? Okay. Well, I'm just gonna close the door and close the curtains for your privacy. I'm gonna go ahead and put the patient in supine position. Okay. Go ahead and do hand hygiene. Some gloves, and get my syringe, my chuck, my alcohol pad. Okay, do you mind if I lower your blanket and lift up your gown? No? Okay. Okay, I'm gonna go ahead and put the patient's legs in a frog-like position. And I'm gonna go ahead and lie down my chuck. Okay, I'm just gonna take off my gloves, perform hand hygiene. Go ahead and put on a new pair of gloves. Open up my syringe. I'm going to go ahead and remove the water out of the balloon. Okay. Get rid of that. Okay, I'm going to go ahead and remove the catheter. So on the count of 3, just exhale, okay? 1, 2, 3, exhale, 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 exhale. Good. Okay. I'm gonna go ahead and grab my alcohol wipe, and then I'm gonna remove the stat lock with the alcohol wipe. Then I'm gonna go and grab the bag. Okay, how was that procedure for you? Good? How did you feel during that procedure? Good? Just a little uncomfortable? Okay. So, If I were to feel resistance when pulling out the catheter, I would go get another syringe and try to get as much water out of the balloon as I can. And if that didn't work, I would go ahead and call the provider. So I'm just gonna pour the Foley bag into the graduated cylinder in the bathroom. And I'm just gonna take note of the color, odor, amount, and description of the urine, okay? Okay. So I am just going to move your legs back. Put your gown back. And put your blanket back. Okay, so let me just remove my gloves actually, and do hand hygiene. So for your first few voids, you may experience some stinging or burning, which is normal, but over time that feeling should subside. So I would like you to use your call bell for those first few voids, just so we can measure your output. So please let me know if you're experiencing any pain or bleeding though while you are voiding, okay? And if you have any difficulty urinating as well, okay? So I'm just gonna go ahead and put your call bell right here next to you so you can call me with assistance while voiding. And I'm also gonna put back your bed in the lowest position. I'm gonna raise the side rails for your safety. So do you have any questions or concerns before I leave? No? Okay. Well, I'm just gonna be documenting the date and time of the procedure, patient tolerance of the procedure, the next 1 to 2 voids of the patient, and the amount, color, and description of the urine from the Foley bag that was poured into the graduated cylinder. Okay. Do you need anything else before I go? No? Okay. Go ahead and clean up and then hand hygiene.